for the wheelchair, I let the patient sat on it, and I push it to the OPD. And with taxi, because of emergency, you cannot even stand and be waiting for the person for payment. And I drove back. The same experience with the General Hospital. I took a pregnancy woman to General maternity. Before we get there, it's midnight. So they have my number and they call me. Before we get there, the person delivered in my car.
Wow.
Oh, the nurses, they did very well. They let me stand at the corner and they clean up the car as if like nothing happened in my car. So for me, sometimes it depends on the person you meet. It depends on the person. That's my experience. Thank you very much.
Thank you very much, Lawe. That's a very interesting point there. Same facility, two different experiences. Let's go to airport. Hello, George. Good morning.
Hi, Coach. Good morning.
So I'm very well, thanks, George. Thank you for calling us. What's your experience?
Yeah, Coach, I just want you to ask if it is at all costs mandatory that they need to take your personal details before they treat you, because I had that experience, I think 8 years ago. Next month will be 8 years ago. I had cholera. Okay, so I was running and had a watery stool, and so I was like really weak, and I was alone at home. So I managed to get a taxi, rush to the health facility. Then I walked straight to where they were taking the records. Now I told the gentleman, "See, this is an emergency. I'm dying. So you attend to me. My bank will pay, or I even have money. I'll pay. Just attend to me because I'm dying. I can't see anything. I'm talking to you, but I can't even see you. I'm blacked out. I can't see anything. So just attend to me. I will give you my records or whatever you need." The gentleman was like, "But there are people here." I said, "See," all I heard was motion, call. That was another patient saying that, and that was around 10 in the morning. I went off. I woke up around 4 p.m. with nurses and doctors all around me. They were like, "Gentlemen, did you come here alone?" I said, "Yes." And they were like, "What's wrong with you?" I said, "I don't know. I think I ate something I'm not supposed to eat." So if it hadn't been God's grace or something, I would have lost my life just because they needed to take my details. Just because they needed to take my details. I went off for about 6 hours.
Wow.
It's terrible. It's terrible. They should give the first aid or whatever, and then later the person will give the details and then pay whatever is supposed to pay. Life is more important than all these things.
George, thank you. Thank you very much. That's one for us to get an answer to from our panelists. So keep listening. We'll get you that answer. We're still in airport. Here's Rita. Hi, Rita. Good morning.
Hello, good morning.
Thanks for calling, Rita.
Okay, so my experience was at the Legon Hospital in November 2020. I fell ill and I was taken there. And even, I don't know how I got there. I woke up, I think, about 2 or 3 hours after. And I wanted to use the washroom. I had drip and other things on me. So I called one of the nurses to assist me. She looked at me up and down. She was like, "Don't you have a relative around?" And she walked away.
Oh, wow.
And I was in so much pain, I needed to use the washroom. For about 5 minutes, another patient's relative was there. So it's like, "Oh, nurse, she asked you to help her." She looked at the woman. If she can do it, she go ahead. And like joke, this lady walked away. So it took the other patient's relative to come and help me. And after this, I just told the hospital to discharge me. And after they discharged me, I wrote a post on Facebook. And unfortunately for them, I also attended Legon. So some of my lecturers saw the post, rushed to the hospital, and they did what they have to do. So I was brought back. And since then, the very patient nobody wanted to have a look at, I had more than 20 doctors coming about almost every 5 minutes to come and see me. So the question I asked myself, must I have to know someone first before I'm given quality health care? And seriously, since then, I just pray. I've not fallen ill since then, but I just don't have any hospital encounter in Ghana again. I just don't want to.
Wow, Rita. Wow. What an experience. Let's take a couple more calls before we hear responses from our panelists. Johnny is in Cape Coast. Hi, Johnny.
Hello. Good morning.
Is this my uncle Johnny?
Sure, could you? How are you?
I'm very well, thank you. Thanks
And
for calling, Uncle Johnny.
thanks for linking me with Daryl.
Oh yes,
although
yes.
it's been quiet since we got really connected.
Yeah.
Yeah, it's not all gloom with the health service.
Mm-hmm.
I had surgery at Kolebu, and I really would like to commend the entire staff. The nurses, they were fantastic. And they made you feel less of the pain that you go through. And the doctors, Dr. Siao Deborah and Dr. Papa, yeah, I sometimes forget his name, although they did a fantastic job. So it depends. One doctor once told me that in every profession, there are 3 categories of workers there. And the first one comprises those who go in there for the money, if that's where they make the money. And then those who go there for the prestige. They think it's a prestigious, I'm a doctor, I'm an engineer, I'm a nurse. And then those who have the calling. And I think Dr. Banker and Dr. Deborah and the nurses that were on the 6th floor, they were fantastic. And I really, really commend them. I really thank them because they did a good job. And they say when you're chewing or you're eating groundnuts, you put in about 4 or 5 nuts into your mouth. But if there is one bad nut in, you have to spew out all the other 3, 6 or whatever. So this is what happens. In the health facilities, I know there are people who went there because they wanted a job. Also, there are all those who went there because they had a calling. Thank you very much.
Thank you, Uncle Johnny. Wow, that's a lot to think about there. Thanks so much for calling us. Let's go to Accra, Newtown. Here's Fafa. Hi, Fafa. Good morning.
Good morning.
How are you, Fafa?
I'm fine, thank you. And you?
I'm very well, thanks. Thanks for calling us.
You're welcome. I would like to share my latest experience I had at the hospital. Somewhere 2010, I was pregnant. And around 8 months, the baby had to come. And then I went into labor a day after lockdown. So there was no vehicle from 3 a.m. to like 5 a.m. There was no vehicle. So I had to deliver in the house. My mom was around. So I said, okay, since we weren't getting a vehicle, there's a polyclinic around our place. We can walk there. So that they check the child since she's 8 months. And then they check if everything is okay. So that later we go to the main hospital. When we went the next day, and the midwife, they got angry. They said, I don't come for antenatal here. So why do I have to come here and all that? And I was like, it was an emergency. There wasn't vehicle at that time. For like 3 hours, I had to deliver in the house. So you just check the baby, check myself, cut the cord and everything. It took us like 1 hour. I should pay this, I have to buy this, and then do that. And after all, they didn't even check the baby. They didn't bath or clean her. They just left her there and then left me there. So from like 6 to 8, another midwife who was on duty in the afternoon came around. Thanks be to God, she came early. So when she came and she saw me, she said, Madam, and I told everything. She was like, and when she checked me, she saw that I had.
Your call has been put on hold. Please wait.
Right, I think our connection has been. Hello, do we still have Fafa? Oh dear. I wanted to hear how that ended. Fafa, if you can call us back, please do. Let's go to Achimota. Hi, Mary. Good morning.
Hi, could you good morning?
Thanks for calling us, Mary.
Yeah, so I totally agree with the man who called before Papa. There are good doctors out there. They are very good ones, very kind ones. So on this note, I want to say a very big thank you to Lakeside Hospital at North Industrial Area, Dr. Yemu and Dr. Frank. One of my girl was diagnosed with diabetes, and Dr. Frank was there for us throughout. So there are very good doctors out there. Thank you very much.
Thank you very much, Mary from Achimota. And Salifu is on the line now from Kufuridia. Hi, Salifu, how are you?
Good morning, Kujo.
Good morning.
Yeah, I think the problem in the medical side, especially it's about the way the procedure, how we go through before we see the doctors. The OPD side.
Okay.
Kujo, if they can automate it so that when you go, they take your PP, they tell you the doctor, the consulting room that you have to go, so that you can queue and wait for the doctor. But times they let it sit down so many hours.
Hello?
Because at times the doctors will be there. But
oh, Salifu, I think there's a problem with your line. We're not able to hear you. So yeah, please call us back. But I think Salifu is talking generally about long delays in OPD processes and how you have to wait for doctors even though he believes they are there. Kofi is in Kumasi. Hi, Kofi.
Hi, Kojo.
How are you?
Yeah, I'm fine.
Wonderful.
Handsome Kojos.
Oh, handsome Kofi, it's you.
Yeah, it's me.
Wonderful. Okay,
See,
what are your thoughts today?
Some doctors are very, very good. Very, very compassionate. In fact, they care. If they are diagnosing you feel that you are getting better. Even though they have not prescribed any medicine, you are getting better. I went to Confanoche with my son, and there was this doctor, a lady doctor. The way she treated my son, even me, who is not sick, I felt okay for my son. And so I told the doctor, prescribe very good medicine for me. And it doesn't matter how much it will cost. I will buy it for my son for him to become good. You see, that is where my problem lies. The doctors will look at you and I don't know, they will tell themselves, well, we won't mean drone. So they just give you paracetamol. Unless you tell them that you can buy expensive medicine before they prescribe it for you. That is my problem. So ask them why they should do that. You look at the person and you conclude that he cannot buy expensive medicine. So let's give him paracetamol. And he will go and take the paracetamol. He will not feel all right and he will come back. So ask them why they should look at somebody and conclude that let's give him inferior medicine. Thank you.
Thank you, Kofi. Thank you. I think we have Fafa back on the line from Accra, Newtown. Fafa?
Yes.
Good. Okay, so you were telling us about how another midwife came along.
Yes.
And was different.
Even it wasn't her time yet, but she managed to stitch me. And after that, she told me she has to go because it's not her time. So when she come in the afternoon, she will take care of me. I said, okay. In about 30 minutes, I was pressed. I wanted to use the washroom. The first midwife told me the tap is not running, so I can't use the washroom. So I was so pressed that for 1 hour, I didn't know what to do. She wouldn't allow me use the washroom just because she said I didn't attend antenatal when I was pregnant. So at the end of the day, I had to be on the bed. Because considering the fact that I had a cut and I was sick. So later on, I think about 2 weeks later, I went to the hospital again. And then I was told I had infection due to the cut and they didn't stitch it on time and a whole lot. It took the grace of God for me to survive. So my question is, if you do not go to a particular hospital when you are pregnant, and then there is an emergency and the hospital is closed, is it a sin to just go for them to treat you? Meanwhile, at the end of the day, I paid for their services. It was so bad. They didn't even bat my daughter. They didn't even give her the injection they were supposed to. A whole lot. My mother wanted to complain. I said she should just forget it. Karma will deal with them.
Fafa, I'm so sorry you went through that. It must have been quite a stressful experience. We will certainly get the Ghana Medical Association to address this in their responses. I think we've also got Salifu back on the line from Koforidia. Salifu, you are talking about OPD processes and how you have a long wait.
Yes, Kojo. So if they can check on those things. Otherwise, the doctors are good. The doctors are always there to attend to us. My 2 years experience at Kolbu Central Hospital is very good. Especially, I want to praise Dr. Jabba, the family doctor.
Which hospital?
Anytime he is on duty, he will make sure that he will attend to you. If you don't understand English, he will explain everything to your local dialect. So there are very good doctors.
Which hospital is Dr. Jabba in?
Come again?
Which hospital is Dr. Jabba in?
Yeah, Koforidia Central Hospital.
Koforidia Central, okay.
It's very, very good. For the past 2 years that I've been attending, it's because the grace of God that I've been consulting him. And he has been very good to everybody, not only me. Okay. So there are very good doctors. Like I was saying, there are always doctors there. But the procedure that we go through before we see the doctors, that is always the worry of patients. So they should speed up on that. Yeah, we pray and that we continue to pray for them. But because they are the people who will take care of us.
All right. Thank you, Salifu. Thanks very much for calling us. Let's take one more call for now and then get some responses from our panelists. Nick Papo, good morning.
Good morning, Ogonfu. How are you doing?
Charlie, Ogonfu, I did for you. How is Bashiman?
It's been a while. Yeah. You know, a few years ago, I had an accident and was sent to the 37 Military Hospital.
Yeah.
And the matron told me that I had to pay some amount to be sent to the ward for further treatment. I paid them. I told her I had very close to the amount she mentioned. She told me I have to pay to the last penny. So I managed to pay the amount, and for almost 2 weeks I was there. When I complained, she was so rude to me. She said, "Oh, just 2 weeks, and you are complaining. You can be here for 2 months or 1 month, though." And I got mad, and I really gave it to her. I displayed. Then I think somehow the one in charge of the trauma and the emergency department got to know about it. He was Colonel Awuku at the time. Then he came with his squad around 4 o'clock and came and spoke to me. He asked what my problem was, and I said, I narrated it to him, and I told him that the woman, the matron, knows everything about nursing, but nothing about interpersonal relation or customer relation and communication. Then he called me and told me that in the era of the Okada and all that, accident happens and 10 people are brought, or 5 or so, but at the ward, only 1 person will be discharged, and then they will ask for somebody to be sent there. So that is the situation, and he apologized to me and all that and fixed the situation. So, like some of the callers have said, they are very good and professional people, and they are the bad ones too. But one quick thing I want to add is that I asked somebody why 37 Military Hospital has become what people complain about, and he told me that now they have civilian people amongst them, and so he suspects that it is the civilian side of the equation that is causing the problem. I want to salute Major Doe at the 37 Military Hospital. He's a professional. Nice day.
Wonderful. Have a nice day, Nick Papo. Okay, wow, we've got quite a lot to digest, and we will do that when we come back from these messages. Stay with us.
Are you covered? In fact, how much do you know about motor insurance? Do you know exactly what it takes to make sure that your car is all-round covered the way it really needs to be? To make the right choice when choosing a motor insurance policy, you need to talk to the right people. Dunwell Insurance offers competitive rates and a choice of covers ranging from third-party cover, third-party fire and theft cover to comprehensive cover. At Dunwell Insurance, we delight in paying personal attention to our esteemed customers and ensure prompt payment of claims. So if you didn't know, now you know. Dunwell Insurance. If it must be done, it must be done well.
What? It seems Royal Foam did not get the memo. Times are tough. Prices are going up. They're giving 10% discount, free pillows with every purchase. Hey, Royal Foam. Just when you thought all they manufacture are quality but affordable mattresses and pillows, they take it up a notch by being thoughtful in these hard times. Royal Foam has reduced their prices drastically. Buy a mattress, get a free pillow. Enjoy 10% discount instantly, nationwide. Take advantage. Enjoy Royal Foam. Enjoy the best. Call 020-227-1000 for other hot deals happening at Royal Foam. Royal Foam. Rest assured.
The ninth Wonder Tours with Adansi Travel is here. It's a Nairobi, Dubai, Kigali, Dubai, and exclusive Dubai Adansi Papebi unforgettable mega tour. Come along on the ninth Wonder Tour as we explore Nairobi, Dubai on Kenya Airways, Dubai on Emirates, and Kigali, Dubai on Urand Air. Each of these goes for 12,990 Ghana cedis per person, 25,900 Ghana cedis for a couple, and starts on 9th August with over 15 different dates to choose during August and September. This package covers flights, visas, hotels, transfers, and 9th Wonder Tours prepared specially for you. Pay for the value of 6 days and enjoy a 9-day tour. There shall be a special all-white yacht cruise on Dubai Marina, guided discounted shopping in Dubai, and a great experience at the Desert Safari. Book your seats now on www.adansitravels.com or call 05955 00817 0552 648 267. You can visit our head office in Accra, East Legon, close to American House. Adansi Travels. Feel life's beauty.
From the press to the people, you're always hustling. You win some, you lose some, you never give up. Persistence, it's what you need to succeed. You want to grow and build your legacy, but even hard workers need a hand. Empower yourself in 5 days with Google Hustle Academy, a free online business bootcamp giving you the skills to increase revenue and investments. Apply today. Grow with Google. Visit g.co/Hustle Academy.
Having your baby try out different tastes and flavors isn't just about giving them a change of taste. This helps to develop their palate and prepares them better for accepting varieties of adult food as they grow. So go ahead and try any of our 6 Cerelac variants, that is wheat, maize, rice, biscuity, fruit pieces, and millet. Remember, each bowl of Cerelac contains goodness that helps your child's normal growth and development. Cerelac, it's all good, Mum. This advert is FDA approved.
He's up bright and early, serving your premium morning radio show. The Morning Man. It's the Morning Man, Kojo Jackson.
I'm afraid of the dark, especially when I'm in a park and there's no one else around. Ooh, I get the shivers. I don't want to see a ghost. It's a sight that I fear most. I'd rather have a piece of toast. Watch the
coffee in your cup. Enjoy on the set. The Super Morning Show is always the best bet ever on Joy 99.7 FM.
Welcome back. It's the Super Morning Show, and yes, we are having a life-saving conversation here. It's about the delivery of healthcare in Ghana. Ghana Medical Association, very concerned about this, and they are helping us get to grips with the problem. You, of course, have been instrumental, giving us lots and lots of questions and scenarios to deal with. I'm going to do a quick wrap-up of what we've heard so that our guests can get to giving us answers. So our first caller was Lawe from Michelle Camp. Now, he is a taxi driver who was once asked to bring a wheelchair after he drove someone in an emergency situation to the hospital, Tema General. Same hospital, by the way, once had staff who actually went above and beyond the call of duty to help him when he brought a woman who had delivered in his taxi. George at airport collapsed while he was being asked to provide details. Rita at Legon Hospital asked for help to use the washroom and was told by a nurse that she should let her relatives help her. Uncle Johnny called to give some props to Dr. Sian Debra and Dr. Banka at Kolebu. Fafa in Accra was pregnant. She delivered one day after lockdown and had to walk to a polyclinic. This story is shocking. Okay, walked to a polyclinic, and this is someone who had delivered preterm, okay, after 8 months. And the nurse said she doesn't attend antenatal there. So not only did they refuse to help her and didn't get her umbilical cord cut for over an hour, that in itself, but also she wasn't even allowed to use the washroom because apparently she didn't go to antenatal there. Mary in Achimota talked about Lakeside Hospital and North Industrial Area and Dr. Frank and I think Dr. Ayemu, who were very good when her daughter had diabetes. Salifu is in Koforidia. He also says long delays and administrative procedures at OPDs are something that he wants an explanation for. He also said Dr. Jabba of Koforidia Central Hospital was great. Kofi in Kumasi said there are very compassionate doctors, and he said something important, that sometimes their manner alone makes you feel better. This is important because it's the point of what we're discussing. Yeah. If someone's manner can make you feel better, then imagine what their manner can also do to make you feel worse. All right, we'll talk about that. Also, he wants to know about why sometimes doctors give you medication based on their judgment of your financial situation. Nick Papo was our last caller, and he said he had an accident and was told to pay the full amount before he was admitted. He also had a rude response to his questions from a nurse, which made him very upset. Okay, so before we get back to our responses from our guests, let me quickly remind you that Polytank is trusted by generations. For 30 years, they've carved their place in the hearts of Ghanaians as reliable, top quality, durable brand that you can trust. Dear Ghana, Polytank says, we are because of you. Thank you for 30. Polytank, trusted by millions nationwide. Polytank, trusted by generations.
Well, there are 100 reasons to buy your airtime with MTN Momo, and you're probably asking why. Okay, so let me tell you. It's really simple. Momo is giving you back 100% bonus whenever you buy airtime from your wallet. Now, that's 2 times the airtime you need. You can schedule your airtime purchase of any amount daily, weekly, or monthly by dialing *170# option 3 and follow the process, or simply dial *170*311# for a superb airtime purchase experience. So whether you're scheduling tomorrow's airtime today or buying airtime when you need it on *170# or *170*311#, you get 100% bonus airtime so you can make twice as many calls and catch up the gist only on MTN Momo.
Okay, the Ghana Medical Association invites all of you to their annual public lecture. The theme is the healthcare worker-patient relationship in contemporary times. It's on Friday, the 29th of July from 2 p.m. at the Volta Serene Hotel. You're all invited to be part of this public lecture.
Well, over the last 20 years, Ashesi has been educating ethical entrepreneurial leaders through high-impact experiential education. The university is now recognized as one of Africa's best, with a bold vision to raise the bar for higher education on the continent. Ashesi graduates are considered among the world's best and receive job offers, start businesses, or graduate schools within 6 months of graduation. As Ashesi celebrates 20 years of impact and excellence, learn more about the university at ashesi.edu.gh. Remember, admissions are ongoing. Ashesi University, 20 years of educating ethical and entrepreneurial leaders in Africa.
All right, now I know you want to respond to all the issues that have been raised and would like to hear your responses, but there were 2 specific questions, so let me highlight those so that you can start from there. First one was from George at airport, who wanted to know whether it is non-negotiable that you must take a patient's details before you give them emergency treatment. And then Fafa in Accra Newtown wanted to know why is it that other hospitals seem reluctant to treat emergency cases if you are not registered at that hospital.
All right, Koyo, thank you so much, and good morning to our listeners. I say my preliminary comments will be that the calls this morning make me really proud as a member of the GMA and of the committee that is doing this public lecture, because it's just highlighted the importance of the theme and the fact that we need to discuss this to bring standards in the health system and health service delivery. Looking at all that we've heard so far, you realize that using the bad nut analogy, there are a lot of people are doing good things, good stuff, but those who are doing not so much up to the standards make the entire thing look bad. And we wish that anybody reporting to any health facility in Ghana can expect a basic standard of care that is not based on who you meet or who you are. You should expect some standard, and that is the whole aim of this public lecture. As you listen to, if you know someone, or you are known, or you are important, then you are likely to get a good care. We don't want that. We wish, because we all ourselves can be patient at any time. So that aside, now to the specific question you asked. The teaching, and it has always been, in the case of an emergency, we have what we call resuscitation. Resuscitation can always go alongside initial details of the patient. Yes, the details are very important because they tell us what you can do and what you cannot do. So we need to know your name so that we don't even confuse your medication with another person. We need to know your age, so we give medication that is age appropriate. We need to know your gender, which will be obvious to us, and a few other things. These are important. Your vital signs will tell us what to even do and not to do. Some patients may see this as time wasting, but we have always taught students and clinicians that do not waste unnecessary time doing these things. And some obvious things can go hand in hand. So you've seen a patient who is unconscious. Start the process of resuscitation even before you want to ask this. The person cannot tell you their name. They cannot tell you bank details. They cannot tell you their mode of financing. So what is obvious to you, it is expected that you will start that whilst you get the additional information. But definitely those informations are also important for this care and for subsequent care to prevent medical errors. So that is the first response. The second one of attending antenatal somewhere, and I think this is a very, very unfortunate situation. And the acts, will I say, are condemnable if they are what they have been narrated here. If you look at the situation, and I'm speaking with passion on this one because I'm an obstetrician, I take care of pregnant women. There is a good reason why, of all the medical records, it is the pregnancy records of a woman that is given to her to carry along everywhere. All of us, your health records are in the hospital, but for a pregnant woman, we give you a handheld book that has all your records. And the reason is that we know an emergency can occur anytime, and she'll be able to enter into any facility. The provider meeting you, just looking at that book, you have a fair idea what you've been through, what to expect, and what they should do for you. And that is the reason why we give that out. Now, this woman delivers at home at a time of a national emergency where we're in lockdown. This is a preterm delivery. Baby may need help, resuscitation, and all of that. And home delivery itself, the environment, whether there was any infection and prophylaxis to prevent that, all these were not looked at simply because she did not attend antenatal there. That is not acceptable in any way, whether public or private. And this is a government facility. And I think yesterday Dr. Morrison made a point. No facility has the right to turn anybody away in an emergency. In a walk-in, a private facility can decide, okay, we do not wish to have you as our patient. But a public facility, by virtue of the fact that you are funded by the government of Ghana, you are mandated by law to care for every Ghanaian who walks into that facility. And you cannot turn people away. And this case is an emergency. So whether it was private or public, once she walked in there, she needed to be attended to. And to think of the fact that we are in lockdown and we're worried that our patients are not coming to hospital, and someone has actually walked to the hospital and gets this treatment, I don't think there's any justification for that kind of treatment.
So let me ask, what recourse does somebody like this have?
Yeah.
What can they do?
Okay. Yes. Again, the law allows all clients of our healthcare delivery systems to make the necessary, shall I say, report or reportage to appropriate agencies for redress when you feel that you have been ill-treated. I said yesterday, the medical and dental, in fact, the regulatory agencies are there to handle these issues. But I guess this whole exercise has given us one big food for thought. It's good we having what I would term a very courageous conversation. And going back to home, I'm sure we would sit down and knit all the pieces together. Because yes, you can't have redress by approaching these agencies. But in hospital, have we got the structures even to address these issues there and then before you make that journey to a regulatory agency?
So we have the structures?
That's what I'm saying.
That's the question we need to answer, all of us.
All of us.
You know, because to cut in, we have a reporting system in all hospitals. They have complaints desks. They have complaints units. In fact, you have the right to walk up to the head of any government facility hospital to make a report. But there are lower levels of reporting. The hospitals are supposed to have internal measures or mechanisms to control this. Outside of that, the legal route is there. First with the regulatory authorities. And you could also go onto the normal legal system to seek redress. And one of the reasons why we are doing this, as Dr. Morrison is saying, is that, you see, this system has to be corrected somehow. It cannot continue. It either has to be corrected by us, the healthcare workers and stakeholders, on our own, or the systems like the legal system will force us to correct it. And from the view of us practitioners, we think if we do an in-house house cleaning and correct the system, is better than using the legal route. Because when we have several legal suits, it will force the system to be corrected. But that comes at a cost.
Yeah.
A huge cost, because when you are practicing defensive medicine, sometimes common sense is lost. And everything you think about is how to prevent the next suit. And so you come with a headache, even though I think this is malaria, ask for a CT scan, ask for an MRI, ask for this. It becomes a very expensive medical practice. And it's been shown elsewhere. So an internal correction from the view of the GME is a better system.
I have a question. There is a patient's charter.
Exactly.
This is a document written by the Ghana Health Service.
Yeah.
But in that same document, I think this is the 4th paragraph, it says, the Ghana Health Service expects healthcare institutions to adopt the patient's charter to ensure that service personnel as well as patients and clients and their families understand their rights and responsibilities. It appears that it's an expectation, not a requirement. Am I mistaken?
Okay. That is actually called from the Schedule 6 of the Public Health Act 885, I think 8851 or so. Yes.
It's now
it's
law.
there. It's law.
It's now law. It's not just an expectation.
It's not just an expectation. Healthcare
it's not an expectation.
Must be working to this charter.
Yes, it's actually law.
Then how are these things possible? So these things break the law.
Yes.
If a woman walks with her umbilical cord to a local polyclinic and is not treated, that is a breach of our law.
Yes.
Yes.
The point.
There's no doubt about that.
Yes. Precisely the point.
How?
So it is the reason why we are emphasizing that the healthcare worker must sit up, the healthcare system itself, the service must sit up, and the patients must all come to the same level for us to all know what is happening. Because it is law.
Yeah.
It is law.
Then a lot of these things I don't understand though. Because look, even in these examples we've discussed, right? Someone is at Legon Hospital, needs the washroom, and is told by a nurse, "Don't you have a relative That is a direct breach of this same patient's charter.
Yes.
It's in violation. So how are these things?
It's not only our Public Health Act that has this. Even the Data Protection Act. This morning when I was coming, I heard you talk about people who are talking to patients, and instead of talking in that privacy, somebody else is eavesdropping or whatever. All these are captured in the Act, and in the Data Protection Act, it's there. You understand? So these are laws that should govern our practices. There are laws that should govern the way we relate to these patients. But unfortunately, as I said yesterday, sadly, we still think we are in the honeymoon period where all of us, I mean the judges, the judiciary probably thinks that because of our numbers, they must show that kind of leniency to us. But let's remember that perhaps that honeymoon period is over. And we need to be proactive, extremely proactive in handling and taking cognizance of all these regulations and laws that we have. But apart from that, I think, Ojo, we also, some of all these complaints hinge on empathy. Exactly. It looks like we may have all the beautiful, wonderful IQs, but probably the empathy side, we need to diligently and graciously work on them. Because with that, some of the comments that you get should definitely not. How can you ask a patient who says, I need your washroom, and then you say, do you have a relative?
Yeah.
It doesn't sit well. It's not anywhere.
Dr. Morris.
Yes, please.
That empathy you talk about, where do we start from? If that person doesn't have it, isn't it obvious the person is not cut for the job?
So,
please go ahead.
Yes, you can start, Titus, and I'll get to Dr. Morris. If you don't have it, is there not enough reason to know that the person isn't cut for this job, has no passion to be in that field?
Well, so if it is proven that the person doesn't have it, really, you have no business in this job, because truth is that a lot of our work requires empathy. You must empathize with. And you see, it's not, you don't even need to be a health worker to have this kind of empathy. Somebody is in pain, has had a procedure, says, help me, and you are asking the person to get someone else to do that when you are being paid to do that. That is unacceptable. You get my point. So, question is, I don't want to explain anything away, but if that has been proven that that is the nature of that staff, then really the person has no business in the clinical setting. But could it be that the person have good days, bad days? What has happened on that day? I cannot tell. But that is not acceptable. And there's a reason why I say we need the standards. You are there for a specified number of hours. And for that time, this is what we expect of you.
But the standards are there. The patient charter makes it very clear what you are supposed to do. The rights of the patient and the responsibilities. It's a two-way affair.
Yeah.
Yes, Dr. Morrison.
Yes. That is why these days, shall I say, the medical fraternity has taken upon itself to be doing a lot of medical legal, shall I say, CPDs, so that we conscientize ourselves and we learn about some of these things. But again, on the empathy side, we could also teach through emotional intelligence. And that would inculcate that attitude in us. But are we doing that?
Tell me, are you doing that?
That is also the issue.
You're not doing that?
So we do, but perhaps I should say at this point in time that we haven't really done enough. Because there are certain things we should have even told our clients, let's be honest, educate them. But I think either we haven't communicated correctly or we haven't done enough. Because why should a patient go to a hospital, for example, and then you walk out, you ask the patient at an exit interview, what's the diagnosis here about? Oh, one can't, maybe say also, it doesn't sit well. It doesn't sit well. It is your right to know.
Exactly.
Yeah. It is your right. You understand? But that patient has been so subdued that he thinks asking that question puts him in an arm's way. And that shouldn't be the situation. That shouldn't be the situation at all. And we're supposed to be, I always say, we're supposed to be a Christian society. More than 73. The Bible, that same Bible. If we go to Isaiah chapter 50, verse 4, it says, the good Lord gave me what? A learned tongue. So that I know in seasons what to say to a weary person. If you're a Christian, of course, I don't have the most the shall I say the Quran,
Islamic,
Islamic version, but this is there. So if the Lord has given you that learned tongue, and we all call ourselves learned people, why should you depart from that learned tongue that has been given to you to say the kind of things that you are saying?
So
it doesn't sit well again.
So for my question is this: we are clear on what is wrong with it.
Yeah.
What doesn't seem clear is how to stop it, because if what you are saying is there's a need for a uniform, that exists.
Yes.
That exists, and beyond that there is even training which they all go through, which is a leveler. You are all trained, and your training tells you what to do and what not to do. In spite of this, they are still doing it. So what is the disincentive? The reason why I'm asking this, look, so when a patient is being treated badly, that is the time it should be stopped, not later after they have complained. When they are treated, they are better, and they go and make a complaint. That is not when the correction is needed. It is at the time they are being treated badly. But as we speak, patients don't feel empowered to speak up for themselves. They don't even know where to go and speak, how to. This woman at the polyclinic, who was she supposed to go and complain to when she was lying on a bed, needed to pee and couldn't? Who was she supposed to go and talk to? That's my question. How do we ensure that it doesn't even happen?
Okay. So could you, in all our service units, just like in this house, people are supposed to work under supervisors. Normally, except for extreme situations, we don't expect one person to be the only person at work. And this nurse would have been working under a supervisor. And if the person was physically present and notices that, the person should have intervened immediately. Granted, occasionally these things will slide through and may not be noticed immediately, and therefore not corrected there and then. And if that happens, the critical thing is to make sure it never happens to another person or the same person. That is where these remedial measures come in. But I think we should look at this relationship, the healthcare worker-patient relationship, as a tripartite relationship. Okay, we are talking about the healthcare worker and the patient. But there's a third factor, and that third factor is the system, the person who sets up the system. If you look at the patient charter tells us clearly, and it's against the law for me to even talk to another patient for someone else to hear. In this modern day and age, with the implementation of this patient charter, you will still find consulting room that is shared by doctors. So I'm talking to Kojo, Dr. Morrison is talking to Winston in the same room. What setup is this? Are we not violating the right to privacy? Well, what you are telling me, Winston can eavesdrop. Similarly, Dr. Morrison, who is not supposed to hear what you are telling me, can hear it, because even between colleagues, when we are communicating about a patient, our ethics require that we share the minimum necessary information for us to be able to make a decision, and not the entirety of this information. So here we are, I need information from you, but 3 of us are getting the same information. So that means that the system is not set right. When you come to this patient relationship with the healthcare worker, with the nurses, with the doctors, there are personal issues which are not acceptable, the healthcare provider themselves, and the other part is that our patients are not empowered. A lot of them have come from the system where, hey, Dr. Kasayen can be. Like as Dr. Morrison said, hey, who are you to argue with the doctor or to even ask the doctor
That's
a
because
question?
some of the doctors tell you,
that is
Which
wrong.
is wrong.
That is the point we are emphasizing here. Every Ghanaian patient should be empowered to know that no doctor, no nurse has the right, no laboratory person has the right to touch you without telling you what they are going to do, and making sure you understand clearly what they are going to do, and all your questions addressed. You don't come to me and I give you a prescription, you wake up, and you don't have the right to know what it is.
So we have to go, but just before that, let's go for this quick break. When we return, we'll continue with the conversation.
Millennium Insurance has enhanced its motor insurance policy cover to make life more comfortable for you, our valued clients, and in the event of vehicle breakdown whilst on the road. To ensure your safety and that of your vehicle, Millennium Insurance will ensure that your broken down vehicle is towed to a safe place within 1 hour of call and 30 kilometers radius from the place of breakdown. This service is absolutely free. Millennium Insurance, your trustworthy partner, is on standby to be of service to you. Contact us now on 0501 394 997 or 0501 285 821. Terms and conditions apply.
Millennium Insurance, your trustworthy partner.
Superbass African Queen traveled from Nigeria to Hollywood. The Banj's Oliver Twist followed suit. CK's Love 110 not far behind took it a step further, going all the way from Africa, touching down Europe, Asia, and even the Middle East. But where and how did it all begin? Discover more about the Afrobeats legacy that influenced the world in the Showmax documentary series, Journey of the Beats, only on showmax.com.
Charlie, so it's actually raining and we can't hear any sound. As for this, your house, when it's raining, no sound. When the sun is up, the interior is cool. What roof are you using?
They use Ico roofing shingles from Interface Limited. Long lasting and beautiful.
Ico roofing shingles. We all for move to Interface and get this Ico roofing shingles.
Interface Limited is the leading supplier and installer of finishing input materials for the building and construction industry in Ghana. Call us on 0274 999999 or visit our website at
www.interfacelimited.net. Facebook Interface Limited GH. Instagram Interface.limited.
The majesty of God in itself goes beyond the capacity of human understanding. On Sunday, the 28th of August, 2022, come join Perez Music, MOG, Akese Brimpong, Ife Grace, and all the way from Nigeria, Peter, as we present Glorified, Theme, Splendor, and Majesty. The venue is Victory Bible Church, Headquarters, Awoshi. The time is 5 p.m. Grab a token for 50 Ghana City single, 80 Ghana Cities double, and 100 Ghana Cities VIP. Token outlets: Joy FM, Sunny FM, Stoots Supermarket, Dansoman, Bachuna Total, and Victory Bible Church Bookshop. Or dial star 365 star 321 hash on all networks to purchase a token. This event is powered by Rima City of Worship. Media partners: Joy Entertainment.
Coffee in your cup and Joy on the set. The Super Morning Show is always the best on Joy 99.7 FM.
One else around, I get the shivers. I don't want to see a ghost. It's a sight that I fear most. I'd rather have a piece of toast. Watch the evening news. Life, oh life, oh life, oh life.
Coffee in your cup and Joy on the set. The Super Morning Show is always the best on Joy 99.7 FM.
Never walk under ladders. I keep a rabbit's tail. I'll take you up on a dare. Anytime, anywhere. Name the place, I'll be there. Bungee jumping, I don't care. My life, oh life, oh life, do life, oh life.
Yeah, welcome back to our life-saving conversation about healthcare service delivery here in Ghana. We've had to say goodbye to Dr. Titus Bayo because he has to actually he's on TV right now. He's moved on to the Joy News channel, but we certainly still have one guest with us so that we can still address your issues. So we're very grateful that Dr. Isaac Morrison remains. Now, he is the immediate past president of the Society of Private Medical Dental Practitioners. Okay, and thanks for your text messages. They're still coming through. Keep them coming on Twitter. Use the hashtag JoySMS so we'll see what you're discussing and share it with the world. Glycocritical Illness Plan, GSIP, it's in your best interest to survive, the sponsors of text messages on the Super Morning Show.
Now, as a business owner, you know it's important to safeguard your business against all forms of cyber attacks, and Cefline knows this too. And that's why we're offering you a business bodyguard called Cefline Internet and Business Solutions, CIPS. With CIPS, you can be assured that hackers and scammers can't come near your business. CIPS is designed to safeguard your production lines, online transactions, social media pages, personal data, and digital assets against online hacks and attacks 24/7. You can choose digital protection, which prevents your social media accounts from impersonation attacks, disaster recovery, which brings back your system minutes after a disaster, cyber protection for online activities, and secured SAP-B1 software that prevents attackers from gaining access to your entire network. Getting CIPS just might be the best investment you'll ever make for your business. Call 0302 745 766 to book a demo and see how Cefline can help you. Cefline, better together.
Better together. All right. Now, just before the break, Dr. Morrison, we were talking about this issue of when to intervene, when to fix the problem. Obviously, the ideal would be that it doesn't even happen in the first place, that every healthcare practitioner operates to a standard so that there are no such problems. But no system is perfect.
That's right.
So there will be incidents like this. How do we ensure that they don't result in loss of life, as has happened in some cases, or serious damage or further illness or exacerbation of an illness? How do we ensure that patients are safe? And I raised the issue of the empowerment. Okay, I've talked about a time when I was being treated at a private hospital, and my blood sugar was being taken, and the lancet that is used to prick my finger for the blood fell on the floor. The nurse picked it up and was going to use it again, and I had to chastise her for it. Well, as a result of that, chastisement, this nurse decided to punish me. She was the only person on the ward, and anytime I called her, she ignored me. Anytime I needed help, I needed to use the washroom, whatever, she ignored me. So she deprived me of health care because I had spoken up for myself and protected myself from a contaminated lancet being used on me. So there are consequences that patients are afraid of, for which reason they will not speak up. So how do we ensure that they are empowered to do so?
Yes, it is a tough one, of course, because once you are ill or sick, obviously you would, under the circumstances that you narrated, you've become a victim of your own, shall I say, rights that you duly possess. But the point is that in every facility, we also have maybe the support staff. Let's say the support staff need to come in this whole scenario. When we talk about the support staff, we're talking about the administrative, we're talking about the counselors, etc., etc., etc. There must be a kind of a unit available within every hospital where perhaps there are clear guidelines telling you that in case you have an issue here, please walk into room so and so or office so and so and initiate that process. And I'm sure when we empower them to do this, they will be able to probably step in. But when you are not satisfied, as we said earlier on, that you can escalate it wherever you want to. But I think if we really put these structures there, so that there and then there's a place where you can make that first bold attempt. And I think it's also important for all of us in the healthcare not to be so possessive and trying to shield our own. This is also an issue that we need to talk about. Unfortunately, it happens quite a lot.
But you see, could you have seen something? If you go to Medicas Hospital, for instance, that's Dr. Safo. It says, "Thank you for visiting Medicas Hospital. Please direct all compliments, complaints, and suggestions to the quality manager." They have a quality manager where you direct all suggestions, complaints, and compliments to. This is a hospital that is clearly telling you that if you're not happy, tell us what the problems are. If you have a suggestion, tell us. Or even if you're happy, you can share it with us. Shouldn't this be the way to go?
Every hospital is supposed to have a quality, shall I say, quality control unit or section. Every hospital, where it is sought, every clinic, every healthcare system. we have what we call focal persons for quality control. And these are persons you can also approach immediately. But as I say, again, this one has clearly maybe put a big poster or signboard or whatever telling people. But sometimes when you walk into most of these facilities, even though that signage is supposed to be there, perhaps all you see is that suggestion box clearly there. But this issue goes beyond just the suggestion box. You need somebody there and then to intervene on your behalf. Otherwise, like I just said, he became a victim of his own circumstance. We don't want that to happen. But if there's an office, clear-cut, like you have just pointed, but every facility is supposed to have this whole unit set up where you can go and maybe perhaps add and define clearly the roles that this particular unit is supposed to play, not just about the quality of care. Of course, this is a quality of care issue, but not just about the hospital improvement, etc., etc. You should look at the patient side and inculcate that into their system. And I think that should be the way out.
I want to bring in Nana Kofi Kwache. Now, Nana Kofi is a health systems researcher and program manager for Impact 4C19. I hope I've said that right, which is at Orem Institute, Ghana. He's on the phone. Nana Kofi, good morning.
Good morning, sir.
Thanks for making the time. I'm sure you've been listening to the whole discussion. What are your thoughts on the situation with the delivery of healthcare in Ghana?
Thanks, Joe, for having me. I think many of the points that we made kind of touch on what I was thinking earlier, which is that the question of care delivery is not just limited to what happens or quality of care delivery is not just limited to what happens in the hospital. That is one component of clinical care. But clinical care itself is a product of the health system, which is broader. It has to do with how it's financed. So can patients get care they need at the time they need it without paying for it? Can they afford it? It has to do with things like health information systems. So like Doc mentioned earlier, can we have patient record details that are available everywhere in the country? It has to do with things like health workforce capacity. Do we have enough physicians? Do we have enough nurses? And do we have them equitably distributed around the country? Those things also influence facility level challenges, facility level practices, facility level considerations. Certainly, there are definitely some bad actors, but I think reducing, if we see the patient or the healthcare worker behavior or delivery as the fundamental cause, I think we may miss the broader question of how our health system is still developing systems to do those critical functions like financing, like regular supply of commodities, like regular supply of healthcare workers. So I think when we look at that, we have to factor in how policy choices impact what happens at the facility and be interested in what kind of frameworks we're using to make our policy choices and how that influences how we spend healthcare budgets.
Right. I was hoping you might give us some examples of some of these policies that make it difficult for healthcare to be delivered in a professional way.
Well, I can give, I wouldn't say just in a professional way, but how it limits what the healthcare worker can do when it comes to things like prescribing a medication a patient needs.
Right.
When I had severe COVID, required a medication called tocilizumab that if you're buying it out of pocket, it costs about 5,000 cedis for a dose. And it meant that if you were a patient who went there and couldn't afford that, naturally the facility doesn't have it there because they don't stock it. And if you have to go and buy it and you can't afford it, there's very limited, scope for what the healthcare worker can do outside of that. That's one example. There's also the question of how we do electronic health records. One of the earlier callers mentioned that in their case, they go into a facility, they spent about an hour getting onboarded.
Yeah.
Doc mentioned earlier that that's a question of whether or not when you go to a facility, there's a system where they can just pull up your basic demographics and medical history. Those are the kinds of things that we have to scale up. We do have these at a small scale, all these critical components. We have the lightweight system for electronic health records. We have the NHIS that provides care for about 95% of conditions. But those things need to be scaled up so that they are available everywhere in the country and support healthcare delivery everywhere in the country. I think the point you made also about patients, or that Doc made about patients not knowing how to advocate for themselves, that's a natural fact of the way medicine works. Most people know less about their own biological health than a physician does because most people are not doctors.
Yeah.
So there have to be patient advocates around who can do that work. And again, that comes down to healthcare worker recruitment. And that's a question of whether or not we have enough money to recruit beyond just the clinical healthcare workers for some of those critical social work functions that also have to happen in the hospital.
Right. So, I mean, this conversation is also supposed to be about solutions. So, you've pointed out that a lot of this is actually at a sort of system level, policy making level. So, while we're working on, regulating the behavior of healthcare providers, what should be done to fix the system so that healthcare workers won't even find the space to mistreat patients?
Well, I think when it comes to quality of care at the system level, it comes down to what kind of systems of accountability you can put in place. This is not an easy question to answer because the answer is nuanced and complex. It's easy to do a short soundbite. But you can have systems in place that link, provider and facility remuneration to quality of care that's delivered. If you look at facilities, a lot of healthcare facilities in the United States, for example, those that accept public insurance, like Medicare for elderly people or Medicaid for the poor, those systems routinely link the actual amount of money they give to facilities and the amount they reimburse healthcare workers to the quality of outcomes they get. So there's a question as to whether or not we're able to collect quality outcome data at a large enough scale to make those kind of policy decisions and implement such a policy. But those are the kind of things that we have to link up in the health system: accountability, financing, health information, and commodity supply. Those are the critical areas where, if we're able to deal with those interventions, it gives the healthcare system and the healthcare worker a better chance of succeeding. So, like I said, while there are bad actors, they are not the majority, that's not the norm, but there are even good actors who are limited in what they can do for the patient because of the systemic limitation. So that's really what I think we have to consider also in looking at quality of care, provider behavior, and outcomes that patients get.
Nana Kofi, thank you for that. Thanks for that perspective. Nana Kofi Kwache is a health systems researcher and program manager for Impact 4C19, which is at Orem Institute, Ghana. Back to you, Dr. Morrison, and something occurs to me. There is a Hippocratic oath, and the first line of the Hippocratic oath is "First, do no harm." So it's not everything that a doctor can fix, but you are enjoined. In fact, you are prevented from doing harm, from making it worse. So anything at all that you do that makes it worse breaks the Hippocratic oath. That includes talking harshly to a sick person. What are the consequences of breaking the Hippocratic oath?
Yeah, that's a big question. Obviously, the Hippocratic Oath contains virtually everything that we've been talking about today. How you talk to the patient, how you handle the patient, how you go to extreme lengths at the peril of your own life to take care of the client. So all these things are beautifully captured. Now the question is, do we just say, take them, swear to them, take our certificates, put the certificates back in our wardrobes, etc., and then move on as though we are doing business as usual? Because if you really contemplate on the issues raised in the Hippocratic Oath, believe you me, and you digest them, I don't see how somebody could go out there and do some of the things that we are talking about. So it means perhaps, and only perhaps, we're just saying them because we need our certificates to move on in life. But as Kojo said, the recruitment, do we really have the structures to be able to decipher and know exactly, to discern, let me put it that way, who should be there? Or is it because we are faced with challenges? And obviously the challenges are there. We think that the first thing is to do mass and then look at how we modify, let me put it that way, perhaps, the psyche, the thinking, and whatever of the personnel that we are producing. But as it's been proved, there are quite a good number of people who still cherish and believe in the Hippocratic Oath, and they will go all ends to do that. The nurses have their own. Other support staff also have their own. But the totality of that is that if you say something to a client, we call it iatrogenic diseases, a word of mouth can even kill the patient. The word of mouth can even kill a patient. When you cancer, that may even send the person out. And we say it with impunity. You understand? So it's a big question. It's a big issue. And we can't just continue saying, we're going to see you, we're going to take them on. Yes, the person knows he's broken the law. Maybe, perhaps we are doing now better with all this, as I say, I keep on saying, the medical legal issues, seminars that we organizing for our membership. It's been more rampant these days. And I think perhaps all the regulatory agencies need to enforce this and perhaps need to go beyond just organizing these things so that some of these things can come.
It's good that steps are being taken in this direction, but I'm asking about what exists. So if I go to court and I swear an oath in court and I break it, I can be charged with perjury.
Precisely.
I want to know what the consequence is for a doctor or any healthcare practitioner who swears the Hippocratic Oath and then breaks it.
I'm yet to see anybody in this country having been taken on. Perhaps somebody has had that before, but I can't recount hearing that somebody has been taken on by the regulatory agencies for breaking typically their oath, except where the judicial process has advanced. But just reporting that Kojo Mensah took an oath that I will do no harm to the patient, and then the counsel or somebody, I'm yet to see that. But when the processes are taken on, yes. And there are 4 thematic areas in that. One is, we have the autonomy principle, we have the non-malfeasance principle, we have the justice principle. That does not allow you to say, this is Alaji coming. So as for Alaji, he's going to give me money, so let me spend all that. I maybe even lied on the floor for him to come and pass. That system is there. And then the beneficence, that is exactly the issue you're talking. We must do good no matter what. So there are quite a lot of issues there. And
wow. So so what that means is that as doctors swear that oath today in Ghana, they know that there's no consequence to breaking it.
In the sublime part of our senses, we know that there's a consequence to pay. But whether we have actively adverse our minds to it, that this is where it will land. Because obviously, if I know that a breach of the duty of care will send me this pathway, obviously I'll be very circumspect and I'll be careful. But we've taken it for granted. And that is why I keep on saying that maybe the suit is not always the way, but at least when 1 or 2 or 3 are done and are publicized, and we colleagues within the health fraternity stop shielding ourselves so that these things can really be managed head on, then we may move forward. Because you can't be doing the same thing every time and expect a different result. Nobody can do that.
Now, all these conversations are leading up to the Ghana Medical Association's annual public lecture. The theme is the healthcare worker-patient relationship in contemporary times. It's tomorrow, Friday the 29th of July at 2 p.m. at the Volta Serene Hotel, which is in Ho. And you're all invited, all of you invited to be part of this public lecture. The future of our healthcare in this country really
there was
could
a
depend
question
on this.
you raised about which has to do with structures. I mean, the nurse was saying they don't have water, so blah. HIFRA is actually mandated to credential you if the infrastructure that you have, at least every facility that intends to provide care must have water running 24/7, irrespective of whatever. And that is why we encourage everybody to have standby tankers, or if you can have a borehole or whatever, because there's no excuse. A hospital should permanently and consistently be cleaning up, and cleaning up you need the water. So it is one of the shall I say, the issues that HIFRA will be looking at for. You must have washrooms, and not just one. You should have maybe a male washroom or a female washroom, at the very least.
Functional.
So, functional, precisely the point, functional. So for somebody to say, I don't have water, and therefore, it doesn't sit anywhere. The laws are there, as I say. HIFRA would come and even ask that you don't operate.
Amazing.
Yes,
amazing. Well, we've learned a lot, as always. We're so appreciative to you, Dr. Isaac Morrison. And of course, we heard earlier from Titus Bill, Dr. Titus Bill, who happens to be the General Secretary of the Ghana Medical Association. He's also a lecturer at the University of Ghana Medical School and a member of the Public Lecture Committee organizing this event. Another member is Dr. Morrison, you've been hearing from. He's also the immediate past president of the Society of Private Medical and Dental Practitioners. Thank you so much for your time.
Thank you so much.
It's the Super Morning Show on Joy 99.7 FM. More after these.
Wanna see a ghost? It's a sight that I fear most. I'd rather have
Coffee
a
in
piece
your
of
cup
toast
and Joy
watch
on
the
the set.
evening